Okay, here we go. Hi, everyone. We're trying this again. It is, as I mentioned, Saturday. I hope you all are doing okay and hanging in there. Please feel free to ask any questions, or if you have any concerns. Sorry, we were having some technical difficulties earlier, and we're trying to get a doctor named Ashita Ganguly to talk to us this afternoon. There's Ashita. Here, let's see. Um, anyway, isn't technology amazing that we can do this? Ashita, as I mentioned, is an internal medicine physician. Hi, Ashita. Hi.
Hi, how are you, Katie?
I am good. Thank you so much for talking to us. I've been keeping track with you through a mutual friend of ours. And so first and foremost, I know that a lot of people are tuning in. First of all, our hearts go out to all of you who are on the front line. So a lot of people are saying thank you to you, Ashita. Tell me a little bit about, people are asking me if I have coronavirus. No, I don't. I'm happy to report. Thank you for your concern. But tell me what you're dealing with at your hospital in New Orleans, because as I just mentioned, it is the fastest rate of spread in the entire country.
So I had the first confirmed case, as you just said.
Go ahead.
I had the first confirmed case about 3 weeks ago. And since that time, as you had just said, the number has risen to over 2,000, almost approaching 3,000. I think that is a gross underestimate and a true underestimation of what the true incidence of this disease is out there. Um, since that time, I work in 3 hospitals in the New Orleans area. 2 of them are almost entirely COVID patients at this time. The third one is about 50 to 60%, and every day that is increasing. I think at a certain point, maybe by next week, they're expecting it to only cater to COVID patients. Um, it's we weren't prepared for this rapid uh, increase in cases in such a short amount of time.
Well, some people are saying, Ashita, and Ashita and I agreed that we'd call each other by our first names, but she was calling me Miss Couric, and I said, please, Ashita, call me Katie. But I read this morning that for every confirmed case of COVID-19, there are probably 5 or 6 undiagnosed cases. So the numbers we're hearing, Ashita, are really, really low.
I agree, and I also think that there are a lot of asymptomatic people who will not meet the criteria for testing, so we won't be able to know the true incidence. Um, a lot of people are pointing to Mardi Gras uh, as the moment when coronavirus really took off. But talking to a few of my patients, I saw that people have been dying of unexplained pneumonia for weeks before. So it was likely already out in the community. We just didn't know.
That's fascinating. So it might have been, maybe it was exacerbated by Mardi Gras, but it was already present in New Orleans.
Right.
Tell me about some of the people that you're treating, Ashita, in terms of their age, their symptoms, what's going on with them.
Yeah. So the age is varied. I have seen, in New Orleans, we already have a population that is already fighting a lot of comorbidities. Diabetes is rampant, high blood pressure is rampant, obesity. All of these things are diseases that make a person more susceptible to getting the virus and needing hospitalization. Um, those are the age ranges have varied quite a bit. We've seen anywhere from 30-year-olds to uh, 90-year-olds be admitted. I am surprised to see the number of 40 and 50-year-olds. Even speaking with my colleagues in New York, one of them had to do chest compressions on a 30-year-old female the other day.
I think it's
So
really
I think
terrifying,
that this is a
Ashita.
disease. disease that
affects just the elderly, which is
absolutely.
what we heard initially. And everything that I've been reading.
I know. This myth has to be dispelled that even amongst physicians, that only a certain age population are inflicted or suffer consequences. I am I'm an asthmatic. I have had terrible asthma all my life, been hospitalized multiple times, and I heard about Kios, who was a wonderful nurse. I've heard from my colleagues who died from asthma exacerbation related to COVID. So no one is safe. And although people my age, even physicians my age have been kind of almost lackadaisical about the issue at hand, we all have to act as if we have the disease and we have our potentials for spreading the disease.
Well,
And
it's, go ahead, I'm sorry.
if we don't, ingrain that into our psyche and we think that this is just a disease that's far off, then we will never be able to address it. This is what the issue was from the beginning. We thought this was only in China, only in Italy, only in Spain. It couldn't come to America. It's hit America harder than it has the rest of the world. And I think it's because of that mentality that this is something that cannot happen to us.
Well, let's talk about you and your colleagues. Ashita, you just mentioned you're asthmatic. A lot of people, when they watch these Instagram live interviews that I've been doing, have asthma and they are very, very concerned. But here I'm thinking about you. You have an underlying condition. You're treating all these patients and you don't have the PPE or perhaps enough PPE to keep you safe. So tell me how you are keeping yourself safe and if many of your colleagues are getting sick.
And it's not just in the hospital. My colleagues who have been getting sick, I have a very close friend of mine who's an endocrinologist. She saw a patient last week who came in. We have screeners at the clinic, but this patient did not disclose that he was having fevers and a cough. A few days later, she started experiencing the GI symptoms followed by fevers and cough. She's been tested for COVID and is awaiting her test. Luckily, she has no underlying lung disease or any other comorbidities. But she's still suffering, even despite being a young, healthy physician. People who, at this time, we will definitely run out of healthcare professionals, given the magnitude of cases. We have to understand that just like the rest of the population, we have underlying conditions. I have asthma. I know other patients who have chronic diseases. Some people have. We are not immune to getting this. In fact, we're probably more likely because we're constantly dealing with people who do have the disease, or we're dealing with asymptomatic people who may not have the classic symptoms,
Right.
but they do have it. And so protecting healthcare workers is paramount. This is not the time to lose our doctors, our nurses, our respiratory therapists, or other allied health professionals. There was already a shortage going into this pandemic. If we lose numbers like China did early on, and Italy did, and Spain did, then I don't think we will ever be able to fully tackle this.
Well, to that end, how are you doing on sort of the N95 masks?
Yeah.
And for the patients, how are you, and other protective gear? And for patients, how are you dealing with ventilators in the hospitals where you work?
So as far as personal protective equipment, we, in order to preserve it, because we see how fast we're running through them at one of our hospitals, we're going through about anywhere from 6 to 900 N95s a day. Um, we are trying to limit the number of physicians that go in to see these patients, to try to preserve um, our reserves. We have our medical students who've been very proactive and going around and collecting as many N95s as possible. But without, which is amazing and heartwarming to see, but without, we need to ramp up domestic production of these. I don't know why that isn't already happening.
I think they're
We have,
trying. I think they're trying, but have you seen this equipment and masks and ventilators? Have you seen them coming to the hospital? Do you guys have
so
enough to deal with now, or what are you worried
we
about?
we have overflowed um, our ICUs, and we have spilled over to the trauma ICUs. Um, they are, we've gotten help from the governor. He's brought over new ventilators. They're opening up new areas of the hospital to make into new ICUs. The problem is, at this point, we have enough vents, but that's only right now. We may not have enough in a week when we see more cases. So that's what we're preparing for. But to staff these ICUs, ventilators are complex pieces of machinery.
You have to be
And
properly trained to use them, correct?
exactly. So to, just assume that, well, okay, we'll have the ventilators, but what about the operators? So that's where PPE is really the backbone of this fight. I have my N95 here.
Yeah, show us that, can you? And are you using the UV light to sterilize it?
So they are now going through the motions of how to properly disinfect them. I think they may be trying to spray hydrogen peroxide or something. I'm not entirely sure. This is, as you can imagine, it's changed day by day. But right now, I know in one of the hospitals, in order to, like I was saying, limit the number of physicians who can go into rooms, they're rationing hard. I have professors who have treated Ebola in West Africa who already had to work in resource limited settings and are just blown away by what they're seeing in America.
Have any colleagues caught this and been very, very ill with this? Or tell me about that.
So far, I don't know of anyone here who's required ICU level of care. I have heard of some physicians getting admitted to the hospital. Um, of course, I'm hearing from New York about people who are at my level of training who are on heart-lung bypass machines and ventilators. So, I think it's only a matter of time, unfortunately, before it happens here as well.
Um, Tell me about if any of these drugs that they were hopeful. First of all, before I ask you about that, what about these Abbott laboratory tests that you can get the results back very quickly? I just heard
The
about
point
this
of
last.
care.
Yeah. Are you
Yeah,
guys getting those?
we are not. But we have some very great professors, minds over here who have done a lot of, who are virologists, who've done a lot of research into dengue and Zika, who are now shifted their focus um, to coronavirus, and they have developed a test at one of the hospitals where they could potentially do in-house testing, whereas before we were sending them out to the state health department. Turnaround time for that is about 3 to 5 days, or the other labs, LabCorp, Quest, turnaround time for those have been about a week.
Wow,
So
that's insane.
yeah, without The way to combat it is to test everyone, even if they don't have symptoms. You know, Katie, I have had patients who were hospitalized for 2 months. We have banned visitors for a couple of weeks now. The patients, you know, didn't have any symptoms other than fever, but then they were testing positive for coronavirus, and it was just kind of I don't know how they were able to get tested, but I imagine if we start testing a lot more people inside the hospital, we'll see that um, there's a great majority that happen without any symptoms. But hopefully this in-house test that we've developed, hopefully it'll roll out in the next few days. We'll be able to do that faster.
So yeah, I hope so, because I think that would be critically important. You know, I know that Drew Brees donated $5 million toward COVID-19 relief efforts. Do you think that might be able to pay for some of the masks you need, or is it really just a problem of supply and availability, not cost?
I think the problem is multifactorial. As long as we still have people coming in droves and need to be isolated, the supply chain will always be an issue. The, we need to also focus on how do we keep people out of the hospital? How do we prevent people from getting new infections? You know, this is exhausting to deal with. I can't imagine all of the ICU physicians and, you know, residents. I was one of them just a few months ago. Now I'm not in that position anymore, but it's exhausting on an everyday kind of day-to-day basis. But in this pandemic, they will burn out. So we have to, sorry.
No, I was going to say you have to get the equipment you need so you can protect the healthcare workers, because if we don't have you all, I don't want to even speculate what the situation would be. I know that the Louisiana Republican Senator Bill Cassidy warned today that the state was nearing capacity and would need help. He said we're on the verge of being at capacity, or he's being told that. Are you guys making, like, the Javits Center is being jerry-rigged to become a hospital with beds? Do you guys have any plans for excess patients?
Yes. So they are turning the convention center into, I believe they're putting in 125 beds there this weekend to take care of COVID patients who don't require, I'm not totally sure, but I think who do not require ICU level of care. They are planning to expand that to as many as 1,100 beds if needed.
I remember that convention center. I think, is that the same one that dealt with the overflow of people during Katrina?
Yes.
Yes, I visited that convention center. I'm curious, Ashita, are you having to, or has it not gotten to this point? I read a terrifying article this morning in Vanity Fair about how doctors are having to basically decide who is going to do well on a ventilator as the number of ventilators declines. Are you having to, or have you talked with the staff about, as more and more patients arrive, these terrible decisions that you're going to have to make with patients, or have you all not even gone there?
You know, we, at this point, we thankfully have not had to make those decisions. I think it would be terrible for a physician to have to make that decision. And if it does come down to that, I do not think that a physician should be the one who's making that decision. Maybe it needs to come from a separate board of ethics because it's just not something that, you know, people should have full faith in us that we care for them and that we are going to do everything for them. We should not be the ones who decide who lives and who dies. So far, we have not had those discussions, or at least if they've happened, I haven't been privy to them. You know, I was told that healthcare professionals would not be prioritized for vents. if it came down to that. But
That really?
yeah, so that's about as much as I know from that part of it. But
You know, so have you seen someone ask for some good news? It's hard to find good news in this situation, but have you seen people come to the hospital and uh, get well and then be released?
absolutely, we're seeing that more and more. And it's great. I think I heard yesterday about the 101-year-old Italian lady who survived COVID and was discharged. So it's not all bad. And they say that about 98% of people will be okay. Um, but 2%, I think the US as a whole is at about 1.5% right now for mortality. Um, it's still too much. And
I have to
it's
ask you, you know, a lot of people I think were pretty shocked, and I want to just go back to this idea that healthcare professionals would not be prioritized for ventilators, which is really, I think, disturbing to a lot of people watching this. Is that an edict from hospital administrators, or is that, I mean, is that something you've just heard? Where does that come from?
It was disclosed in something, in a memo to everyone within the hospital. Um, I'm not sure how that was decided, and that was just one of the hospitals of the many that we work for. I don't know if all hospitals have thought of that or if they have policies regarding that.
That's
Um,
infuriating. And I know that a lot of doctors are writing their wills and they're also doing videos for their kids. Can you just in closing, Dr. Ganguly, because I want you to either get some rest or get back to your patients. And I guess the question is, what is the mood among the physicians?
it's, for me, this has been a very earth-shattering event. Um, I graduated residency about a year ago, and I'm in the middle of my training. I feel that I have decades worth of, I've invested so much of myself, sacrificed so much of myself, and I'm prepared to invest the rest of my life into helping people. Um, I know that I have a very high risk of dying from this if I do contract it, given my past medical history. I don't think that this is going to get better as far as I feel that, this could go on for months, maybe years, and there's a good chance that I'll catch it. My parents are both physicians. My father's almost 60. He has cardiac issues. He's offered to replace me in my physical duties.
Oh,
They're so afraid that about my health in case this hits me. I've I've reached out to some of my lawyer friends to see what I should do. Not that I have a lot of uh, resource or money as a trainee or anything, but in case something happens, I wanna make sure that it's all dealt with. But we went into this field to help people, not to become martyrs. So whatever whatever the government can do, whatever people can do to please protect us so that we can carry on our jobs and take care of people. And then and in the most evidence-based way. Um, Guidelines are changing daily, and I just hope that they're not based on supply stock and are instead on sound science. Um, but yeah, it's a very sombering moment to be practicing medicine.
And do you have psychological support? You know, it's so traumatizing for you all. Do you have people you can talk to who, I mean, I think right now you're getting a virtual hug from everyone who's watching this and is so moved by your courage and the fact that you are at high risk anyway. Uh, but do you feel like the medical system in New Orleans is giving you the psychological support you need as well?
I think, before I came on to work here, they've battered through some pretty difficult circumstances. They've gone through Katrina together, and I think some of them have said that this is bigger than what Katrina was. They have been very supportive and um, very open and receptive to any concerns that we have. I think that will continue.
Well, Dr. Ashita Ganguly, all our hearts go out to you, and please uh, stay as safe as possible. I know you're wearing your N95 mask. Um, uh, do you have other equipment that you feel like is going to protect you somewhat? I hope, I pray.
I wear my glasses usually. Sometimes it's hard to find the face shields, but hopefully, with rationing, we'll be able to make do. But we need more. We need more gowns. We need more face shields, and more N95s. I feel at this point that some of the um, the Chinese street workers who are sanitizing the streets are more equipped than we are, um, which is saddening. But I'm hopeful that we'll get there. But the pressure needs to be maintained on those in highest position, that they need to keep manufacturing this and they need to be distributing this.
Well, please stay in touch with us and let us know how you're doing. We now can communicate through email, and I think my followers would really like to uh, continue to follow your story. Please be careful, and thank you for everything you're doing, and please thank all your colleagues. People are asking about medicines. I guess the anti-malaria drug and the zithromycin, I guess the Zithromax or whatever. Are you giving some of these people those drugs, and do they seem to be working?
We are, but it's so hard to say. Uh, Early on, every day this was changing. We are getting better at having a protocol in place for all hospitals, so that we can do the same thing for every patient and see if it's truly working. But that's going to take time
And
to.
it can be quite dangerous, I understand, in terms of the dosage, and can create heart problems. I mean, it's so new, this virus,
Right.
and so little is known, and it just
It's
came on so quickly that it's hard to really, you can't just wave a magic wand and say this amount and this amount is going to cure people.
right. We know that this disease can cause something called myocarditis, where it affects the heart. And some of these medications that we're using are also possibly cardiotoxic. So, we're being careful about what we do.
Which is
Uh,
really important because you don't want to add to people's problems. And
exactly.
I talked to a doctor 2 weeks ago, and he said, it's one thing, and even people who survive this may have some damage to their lungs or to their hearts. And so it's complicated, isn't it?
It's very. And for SARS, there were some studies that looked at survivors, and about 25% of them had decreased lung function about a year and a half after the illness, after surviving. So we're still yet to find out what this does to people in the long run.
Well, a lot of questions to be answered, including why some people get it really badly and other people are asymptomatic. You know, is it
Right.
something about their biologies? Is it the amount of exposure they experienced? You know, who knows? So we're going to be learning about this virus in the weeks and months to come. A couple of people are asking about, I know, are feeling anxious. And tomorrow at 2 o'clock, I'm actually going to have a therapist who's a friend of mine, Lori Gottlieb, who is a therapist, a psychotherapist, to answer people's questions. So if you're free and you feel like it would be helpful to you, let us know.
Absolutely.
Anyway,
Absolutely.
so nice to meet you, Ashita. Please give my
Likewise.
best to your wonderful parents. Where do they live?
They live in a small town called Paris, Texas.
Wow, I've heard of Paris, Texas, I think.
Yeah, yes, it's about 25,000 people outside of Dallas, Texas, about 90 miles. So,
Well, please give them my best, and tell them
yeah.
they have a lot of people who are praying for their daughter out there.
Thank you so much. That means so much.
All right. Bye, Ashita.
All right, bye, Miss Berkeley.
Thank you, Katie, please.
All right, thank you, Katie.
Okay. Thanks, everyone.